Hi everyone, this is my cholecystitis case presentation. A 40-year-old female with a history of multiparity presents to the ER complaining of 10 out of 10 abdominal pain, nausea and vomiting after eating a fried chicken sandwich and french fries. She is positive for Murphy's sign or right upper quadrant pain with deep palpation. Her blood work shows leukocytosis, elevated liver enzymes, and normal lipase and amylase levels. Her vital signs show mild tachycardia and hypertension, likely in the setting of severe pain. A gallbladder ultrasound and abdominal CT scan show gallbladder wall thickening and gallstones suspicious for cholecystitis. A hepatobiliary or HIDA scan is ordered to assess for ductal obstruction and gallbladder function. A surgical consult is placed for a laparoscopic cholecystectomy evaluation. She is given 30 milligrams of IV ketorolac tromethamine for pain management and admitted for surgical workup.